of minutes. We'll just give people 2 more minutes to join us, and then we'll get started. But thank you so much. We're really looking forward to a great discussion today around gender, education, and COVID-19. Great. Well, hi there, everyone. As we wait for a few more of our participants to log on, I just want to remind everyone of a few of the webinar housekeeping points here on the slide. So just to reassure you all, as participants, your audio and video are currently muted. So don't worry, we can't see or hear you. I know sometimes participants are worried that they're interrupting, but you are automatically muted due to the large numbers. You can post questions using the Q&A function at any time, and we really do encourage that. We really want to hear from you, and I know our panelists will be happy to respond to your questions. So throughout the discussion today, please do share your questions in that Q&A function at the bottom of your screen. And just to remind everyone that this session is being recorded and will be available via the INEE website and shared with everybody after the webinar today, and please do share that with your own networks. We will have closed captioning available in English. They haven't begun yet, apologies. I think there's a slight delay, but hopefully they'll be joining us shortly and you'll be able to access the closed captioning soon. And just a reminder that the recording and presentations will all be shared afterwards. But I think as we're a couple of minutes past the hour, let's get started. Hannah, if you could just move to the next slide. So welcome everybody. It's wonderful to see so many of you from so many different parts of the world. We're here today for a webinar focusing on gender and education during COVID-19. This is part of a webinar series that we're running here at INEE, which really aims to create a space to bring people together around the critical issues they're finding in their work at the moment as they try to provide education in already complex humanitarian and protracted crisis settings, and now even more complicated with the implications of COVID-19. We've had 7 webinars already, and you can find the recordings for these on the INEE website, available for all of you, as well as our resource collection, which I'm sure there are many relevant tools and resources, so please do take a look at that. But we're really excited to have a gender focus today. This is, such an important area of our work, and we know an important area of work for many of you that affects everything we do. And we heard very strongly from our participants in our other webinars and through the survey we did at the start of the crisis that gender was an area we really wanted prioritising. So I'm really grateful to the panellists we've got today and to all of you for joining us. But before I take a look at the agenda, I'd just love to hand over to our director here at INEE, Dean Brooks. Over to you, Dean, for a proper welcome.
Thank you so much, Charlotte. And thank you everyone for joining. Just to take a moment and also to thank our panelists and mention, that we know that disease outbreaks like COVID-19 affect women and girls and men and boys differently. And as we know from past epidemics, disease outbreaks intensify existing inequalities for women and girls. We urge our members to apply a gender lens to EIE programming through preparedness, response, and recovery. And we call on our members to pay particular attention to those facing multiple intersecting inequalities and discrimination. Charlotte's already mentioned some of the information sharing that INEE is doing. We're also looking at advocacy, and we're also collaborating on a common messaging framework on gender and COVID led by UNGAI, and we support their efforts to harmonize and amplify advocacy around gender and COVID-19. I'd also like to briefly mention a new partnership INEE has around gender. As some of you may know, INEE is being supported by Global Affairs Canada to carry out work around the Charlevoix Declaration on education for women and girls in crisis-affected contexts. And we'd be happy to share more information either in the Q&A or feel free to reach out directly to the INEE Secretariat, in particular, Laura Davison and Lauren Gherkin, who are on the INEE team, and their contacts will be in the chat function. So thank you very much. I'm happy to hand over, and thank you, Charlotte.
Thanks so much, Dean. And yeah, just to reiterate that, the thanks to Laura and Lauren and our wonderful Gender Task team and all of their efforts in prepping for today's webinar. So we've got a great agenda ahead of us with a range of perspectives and contexts, and hopefully some really sort of practical examples to help us all in our work. So we're going to begin with an overview and framing from our colleagues at UNGAI. Thank you so much for joining us today. We'll then have a sequence of panel presentations. The first will look at the work the Girls Education Challenge are doing, sort of this approach to gender and social inclusion at this time. We'll hear from our care colleagues talking about mental health issues and COVID-19 response in Somalia. We'll also hear from colleagues at UNRWA looking at education in confinement and implications for gender. We'll also be hearing from colleagues from Plan International looking at distance learning and teacher training in Latin America. And last but by no means least, we'll be hearing around advocacy efforts for girls' education from Malala Fund colleagues in India. We'll then finish with a question and answer session, forgive me, and we hope to have a good 30 minutes for a moderated discussion. So as I mentioned, please do share your questions in the Q&A function at the bottom of your screens. I'm gonna pause there because we want to make the most of our time with you all today, and I'm going to hand over to our first speaker. Hannah, if you just share the next slide, it gives you an overview of our wonderful panel today. So we're going to begin with Nora Files, who joins us from UNGAI. We'll then be passing to Rachel Booth, then Lot Renault, then Hanan Al-Kanash, then Emily Mwanza, then Janina Hirata, and then lastly Anubhuti Patra from the Malala Fund. And then all be on for the Q&A at the end. So thank you all, but let's turn over to Nora for the orientation for today's session. Thank you.
Thank you very much, Charlotte, and it's a pleasure for me to be with you today. Great, thank you for that. We can now go straight into the presentation. Could we turn to your first slide, please? The COVID-19 pandemic is an unprecedented global emergency, putting the whole world at risk. At the same time, in most protracted and humanitarian crises, COVID-19 is exacerbating inequalities already faced by vulnerable populations, particularly adolescent girls, and in countries which are dealing with crises, famine, hunger, flood, emergencies of various kinds. Lessons from the Ebola crisis show that school closures can lead to increases in gender-based violence, teenage pregnancies, child marriage, exploitation, and other forms of abuse against adolescent girls. Now, this conflict crisis, a protracted or humanitarian crisis, is not a very welcoming environment for girls' education in the best of situations and without the COVID. In these areas, girls commonly face multiple barriers to accessing safe and quality education due to various forms of discrimination and already have the weakest learning outcomes. Countries experiencing extreme poverty and economic vulnerability and crises have the highest gender disparities in education. There's a higher proportion of out-of-school children and adolescents in conflict-affected countries, many of which are girls. And for girls living in refugee camps, informal settlements, or who are internally displaced, school closures will be the most devastating, as they already are at a disadvantage. Schools are a lifeline for many girls, providing essential health information, regular meals, and protection from exploitation and violence. While many girls will continue in their education once school gates reopen, others will never return to school. New analysis by Malala Fund shows that up to 10 million more secondary age schools could be out of school after COVID pandemic is over. Education responses must prioritize the needs of adolescent girls at the risk of reversing 20 years of gains made for girls' education. Next slide, please. With school closures, ministries of education rapidly sought to put in place systems for continuous learning, with the expectation that girls and boys alike would be able to study at home. However, during school closures, girls often take on the duty of care for younger siblings and other family members, in addition to increased household chores. They just do not have time for learning at home. In addition, while a range of continuous learning options are put in place, much attention is on online approaches. Even where computers or smartphones are available in the home, electricity stable and internet connections maintained and data paid for, a focus on high-tech options puts girls at a disadvantage. Throughout the world, economic, social, and cultural obstacles means that women and girls have less access to internet and technology than men and boys. In South Asia, as just one example, access to mobile internet is 26% lower for women and girls compared to men and boys. This becomes an education problem when the means of continuous learning is the mobile phone or computer. In many situations, particularly those disrupted by conflict or crisis, online learning is limited to the urban elite. In sub-Saharan Africa, 89% of households have no access to computers, and 82% lack internet in the home. This is not a ready solution for all. We must insist that countries need to adopt appropriate distance learning solutions, to invest in low-tech, affordable, and gender-responsive distance education methods, such as radio broadcasts to support continuous learning. And finally, more time online also puts students at risk to cyberbullying. Families need to ensure online safety measures are in place to protect girls from harassment and predators. Next slide, please. Around the world, in almost every country affected by the pandemic, we have seen a shocking spike in domestic violence against women and children since families have become confined to their homes. Pre-existing gender inequalities and harmful norms have combined with an increased exposure to abusers at home, heightened anxiety and economic shock to increase a potent mix for violence to thrive. This is ever more likely to be the case in countries where violence is commonplace and military present in communities on a regular basis. In South Africa, for just one example, 87,000 reports of gender-based violence were reported in the first 25 days of confinement. And there are examples from around the world, which is just hard to keep up with, in fact. And adolescent girls are a particular risk. During the 2014 Ebola outbreak in Sierra Leone, increased rates of sexual and gender-based violence incidents were recorded, and teenage pregnancy increased by up to 65% in some areas. Unfortunately, resources for sexual and reproductive health and gender-based violence services are being diverted to the response effort, even in humanitarian crises. And even in the best of situations, support services are not readily available for adolescent girls. It is really important for education partners to work closely with protection and women's rights and GBV partners to understand the specific risks faced by girls and boys and ensure alternative education includes information on updated referral pathways, hotlines, etc., where these exist, to include community awareness raising as part of the education messaging, such as around zero tolerance campaigns. Provide also psychosocial support and emotional learning for parents and teachers and caregivers. We know it is not uniquely the experience of adolescents and children, but adults, adult men and women, and support for them is also critically important at this time. Now, finally, I want to recognize that sexual and reproductive health and rights education and resources for adolescents are being diverted during the outbreak, and in some cases, online learning can provide a new opportunity for comprehensive sexuality education to be made available for adolescent girls and boys. Where cell phones are available, using SMS and social media to push out youth-friendly messages can provide a new source of information. And in some environments, the same process can provide a safe space for virtual clubs. Last slide, please. Now, as countries shift from distance learning to recovery, we need to learn from experience and design the re-entry to address the risks of girls not returning or not remaining in school. Last week, UNESCO convened an online meeting of ministers of education, during which 71 countries announced plans for school reopening. Now, while a number of the ministers of education and their other representatives spoke of safeguards and a range of innovative approaches, including to address the needs of vulnerable groups, not one person mentioned concerns regarding adolescent girls. Some countries are doing extremely innovative and positive things to integrate gender into their return to school plans. South Sudan has been endeavoring, for example, to provide conditional cash transfers for girls, even when schools are closed. And in other countries, their resource plans mention not one word about gender or girls' education. Now, in our role as partners, and as we engage with ministries of education to support them in their development of national responses in the recovery and reopening, we must insist that a clear gender lens should be applied. We must promote girls' re-entry, engage with communities to support girls' return prior to the reopening, and advocate for policies to ensure that the entry of young mothers and pregnant girls, provide online training for teachers on child protection and gender-based violence. We must reduce girls' dropout, meaning adopting strategies for cash transfers, scholarships, and fee-free schools, as well as meals and sanitary kits to reduce the risk of girls reverting to survival sex or dropping out due to the just lack of cash in the house. And support girls to participate, developing catch-up or accelerated education processes and programs, including arrangements such as flexible scheduling to accommodate caregiving responsibilities, and ensure the establishment of regular and safe delivery of essential services, making schools platforms for health and well-being during reopening, including a focus on protection, on psychosocial support, gender-based violence, and abuse. Thank you very much.
Thank you so much, Nora. Really powerful reminder, I think, of these implications, for gender implications related to COVID-19, and also some such important considerations, both as we continue education provision in the immediate term, but also, as you say, planning for reopening and recovery. So thanks so much for those opening remarks. Just on a very practical note, the closed captioning has begun, so please do feel free to use that option at the bottom of your screen if you find that helpful. We're now going to hear what some of these considerations that Nora's kindly raised are looking like in practice. So I'd like to hand over to Rachel Booth from the Girls Education Challenge to talk about their efforts to adapt and work at this time. Thank you so much, Rachel.
Hi there. Yes, so my name is Rachel Booth and I work with the Girls Education Challenge, which is a UK aid programme funded through DFID with 41 projects across 17 different countries. So next slide, please. So I sit at a portfolio level where we're able to see how these projects, many of whom have been in long-term development contexts, and others in contexts who've been working in protracted conflict or fragility, and how they're all having to adapt to the current circumstances. So on the GC, we have a gender equality and social inclusion framework we work within, which help us keep gender and inclusion at the centre of our thinking. So for example, we have the GESI, the Gender Equality and Social Inclusion Standards, underpinning the project's approach. And some of those standards include making sure that GESI analysis informs design, that data is disaggregated by sex, age and disability, that monitoring systems are split by subgroups, and so we have visibility through monitoring systems, But we also have this language of the continuum, which is used by many gender specialists globally. And it really helps us analyse how initiatives are considering gender and inclusion, and whether they're absent from design or whether they have the potential to become transformative. So it's within this framework that really helps us structure our response to the current crisis and maintaining our GESI lenses. Okay, thank you. Next slide. So all of our projects are having to pivot in the current circumstances to think about their education projects and how those are going to adapt to respond to the current crisis. In emergency contexts, the need for updated gender and inclusion analysis is often squeezed out in the rush to get activities moving. Yet we see it as a really fundamental building block for subsequent design decisions. And we've seen some great examples of that across the Girls' Education Challenge. For example, Plan Zimbabwe and ActionAid Kenya have been updating their existing analysis and revealing many of the issues that Nora has just mentioned. But the other dimension they're adding to it is this subgroup analysis. So really thinking about those risks for different groups. What does it look like for girls with disabilities? What are those risks for girls who are married? What are the issues for girls who are pregnant? And making sure that we're really breaking down our analysis to be clear about what the context means for them currently. We've also seen some really great examples of technology mapping exercises. So Plan Zimbabwe, again, are really looking quite deeply at the ownership of technology and connectivity by areas, who has phones, TVs, radios, but really thinking about the power over those assets and resources as well. Who controls the technology at the household level? Again, for those subgroups, who has access, and would providing new technology potentially put girls at risk? And really trying to understand where the gaps might be. So for girls with disabilities in particular, how can we reach those girls, and are there gaps in terms of getting messages to them? So we have realised that the learning from this is really that we have to think about blended channels to reach as many girls as we can, and that investing purely in one is probably not going to reach as many girls as we want to. Making sure that participatory design is key to the next process as well. Mercy Corps Nepal have done some really interesting exercises where field staff are phoning key stakeholder groups, so that's girls, parents, teachers, and cooperative members, for example, and they get weekly updates on living conditions, on their changes to circumstances, and what kind of support and coping mechanisms the people are using. And those findings are fed into weekly team meetings, and they're assessed in terms of the feasibility of the activities that the project is suggesting and what the changing context means for that input. And within all of this, the GEC projects are working within the safeguarding guidance to keep in contact with girls and how to do this safely. So based on a lot of this analysis, projects such as Relief International in Somalia are aware of how important it is to maintain life skills and social emotional learning component of outreach. And they're looking at options to share life skills sessions through WhatsApp and social media platforms. They're considering life skill themes and the frequency and the interactivity and how they can engage students. Again, thinking about those safeguarding measures and simple tips on how to remain safe online. We've also seen some great examples of ensuring that learning channels are accessible for girls with disabilities. So Plan Ghana have been supporting the Ministry of Education to develop the Ghana Learning Channel, including the use of subtitles and sign language for national broadcast. And it's really our hope that within, after this phase, there's going to be a real growth of innovation for remote learning and support programs, that we will be able to move forward with much more evidence and many more resources of what will work for girls in marginalised contexts in the future. But I think there are two key messages I wanted to leave you with, which is now is not the time to relax our gender and inclusion analysis. It's more important than ever to keep that up to date and informing our design decisions. And now is not the time to strip back learning content. Life skills and information about sexual reproductive health and services and safeguarding reporting is absolutely vital in these kind of contexts. And again, as Nora mentioned, lessons learned from the Ebola crisis that we're drawing from heavily illustrate how important it is to maintain our focus on marginalised girls' circumstances and maintain communication support through these crises to ensure that they're likely to return to education after the crisis is over. So I think I'll leave it there, and I'm looking forward to hearing from the rest of our participants.
Thanks so much, Rachel. Yeah, two powerful powerful takeaways for us there at the end. Thank you so much, and great to hear about this kind of approach and adaptations as everyone takes their work forward at this time. So now let's hear from what that might look like in a bit more detail on specific issues and specific contexts. So going from that broader picture now to more of the specifics. I'm going to hand over to Lot from CARE, who's going to start us off by looking at mental health considerations and the COVID-19 response in Somalia. So thank you, Lot, over to you.
Thank you, Charlotte. And good morning, good afternoon to everyone who is attending this webinar. I am going to share some of the results from our approaches in Somalia, specifically from the Somalia Girls Education Project funded by the Girls Education Challenge and implemented by CARE and ADRA. In our project, we are working with girls in rural and remote areas, in particular contested areas that have been facing recurrent patterns of conflict and drought through the past 7 years, and continue to see those problems exacerbating through time. We have noticed a really huge proportion of anxiety and depression among our participants. At our baseline, it stood at 16% and 13%, respectively. And anxiety and depression were by far the most prevalent types of disability. As COVID-19 sets in and it's evolving really quickly in Somalia, with 28 documented deaths so far and infection numbers in the hundreds, those that have been identified, we are imagining that the situation in terms of mental health issues is going to become worse. Girls will be out of school for months, increasing their social isolation. The ability to meet peers, the ability to be with teachers and mentors creates a protective space for girls who are already facing massive stress and a recurrent pattern of violence in their daily lives, as well as different types of deprivation. The stress generated by the crisis as it sets in becomes even more prevalent and generates more anxiety and depression. And so, responding to your question, we are working in Somaliland, Puntland, and Galmudug, but specifically in Sulsanak, Togdir, as well as in parts of Galkay. As the disease then becomes more evident, we expect that the girls from the affected families are going to face discrimination. And in particular, those who are caring for the sick are likely to be discriminated by their peers. We also expect that we will have severe financial impact, both because of the economic downturn that is already being observed in the region. Prices are already going up by 15 to 20%, but also because of the cost of managing illness at the household level and the inability to dedicate as much time to labor. The financial impact on the household is likely to exacerbate early marriage, which is already highly prevalent, as well as potentially exacerbating exploitation and child labor and abuse, as mentioned already by Nora in her presentation. And as everyone is mentioning here, there is a high degree of vulnerability to gender-based violence and just to violence in general, as resources become scarce and fighting is likely to become more prevalent. As we were tracking anxiety and depression through the years, we noticed that both are predictors of poorer learning outcomes, decreasing results in numeracy and to a lesser extent in literacy, but they are also predictors of dropout. So girls facing mental health issues are likely to drop out and far less likely to transition to the next grade or to the next level of education. And this is massive. The reduction hits to 15 or to 25 percentage points in relation to those not facing those conditions. So we really need to zero in this group and support them to avoid a terrible outcome once classes resume, or just to see a very large number of girls dropping out. Could you kindly move to the next slide? Thank you. So our response is an integrated one. We have seen positive effects of girls' leadership clubs, which we call girls' empowerment forums, in supporting girls facing anxiety and depression. But at the moment, they cannot meet in groups or in schools as they were doing before. So this requires more peer-to-peer support and regular check-ins from mentors and from the participating peers on the girls who start showing the symptoms of anxiety and depression, and to acknowledge that they need support in a situation where many people do not acknowledge mental health issues as a problem. Community education committees who have been effective in following up on dropouts are undergoing regular check-ins with at-risk girls and their families. The accelerated education teachers we are working with are also providing counseling to the girls who are affected, respecting social distancing, but acknowledging that they all live in the same village and they will be sharing the same space. We are building upon things that have worked in the past, that have decreased anxiety and depression, and trying to mitigate the impact for this group upon recovery. And we need to combine this approach with remote learning and financial interventions such as cash transfers or scholarships, acknowledging that remote learning is only one part of the equation, and a girl facing anxiety or depression is less likely to participate in it. Also, even if we give cash transfers, a girl facing anxiety or depression might not be able to return to school in a timely manner. Thank you. And Charlotte, my apologies, I went 1 minute over.
Quite all right, Lot. I appreciate there's a lot of important information to share. Thank you so much for sharing this example with us. And if colleagues on the line do have questions, we would be happy to put those to Lot in the Q&A. And I'd also encourage participants, we did a webinar on psychosocial support and social emotional learning where some of these issues arose. So do feel free to look at that recording as well. But thank you, Lot. Great. Let's move on to our next example and our next context. I'd really like to hand the floor over to hear from our UNRWA colleagues. So we've got Hanan and Emily on the line, and over to you.
Yeah, thank you very much, and good morning, afternoon, evening, our colleagues and audience. And I'm really happy to be presenting Education in Confinement, Implications for Gender, myself and my colleague Emily. Next slide, please. In UNRWA, we provide education in 5 fields of operation, and our services are provided for males and females, as you can see from the figures on the screen. We believe that it is really important to have gender parity, and we achieved actually gender parity in enrollment in the early 1960s. We heard from our colleagues that data is really important, and in UNRWA, gender is mainstreamed into the monitoring and evaluation through six disaggregated data. So from the data, we know that there are certain achievements and results that we have achieved with regard to education for girls. So we know that we have, for girls, lower dropout rates in general, and they are they have higher level of achievement in the agency and in the fields of operation. But as we know, it's not only girls that matters, because gender is also boys and girls. So the data that we analyze also help us look more specifically about issues with regard to boys. So when we have a look at the agency dropout rate, we notice that there is a reduction in general, but specifically for boys, and specifically for an example in Gaza, there has been an increase for the dropout of boys in the elementary and the preparatory stages. And of course, we dig deeply in order to understand why and the reasons behind these in order to address interventions. Of course, the education program in UNRWA has a systemic and a holistic approach in order to help achieve results and address challenges. And this helps us also working through the COVID-19 crisis. And I will now let the floor to my colleague Emily to start talking about this approach and the response to COVID-19. Emily,
thank you,
please.
Hanan. Thank you. So in order to have a better response related to gender issues, there has been extensive work within UNRWA, starting from the education reform to ensure that gender is addressed explicitly in our policies, in the strategies, as well as in school professional development materials. So furthermore, UNRWA ensures that all materials are written in a gender neutral language with gender positive examples. And additionally, in order to support teachers, UNRWA has developed the teacher guide to help them address gender bias within the classroom. And building on this, UNRWA has implemented its human rights and human rights conflict resolution and tolerance program in order to support boys and girls in becoming agents of change, and also to help them to raise awareness among their fellow students. And through this, the School Parliament Initiative was created as a platform to support them in this venture. So UNRWA has also designed TVET short courses to address the needs of male and female students to support their employability. And in 2019, there was a noticeable reduction in this gap in employability between male and female students. Next slide, please. So in the response to COVID-19, UNRWA has taken into consideration work that has already been done and is known, and so has developed its response in a holistic manner, taking into consideration the 5 factors listed above. Within this response, UNRWA has built on psychosocial support, already established practices within the agencies, and counselors have been providing psychosocial support to students during this period of COVID-19. So to further strengthen the support of students during this time, UNRWA developed a resource booklet from credible resources, and this guide is focused on learning on health and safety. Counselors and health education specialists have also established a community of good practice in order to provide psychosocial support to students. And through this, fields have created hotlines in which counselors are able to provide psychosocial support to students. And this has been key in addressing a likely increase in GBV violence in the households. And finally, in the response, UNRWA always ensures that all self-learning materials developed undergo a process of rigorous review, and within this process, a lot of criteria are noted, and one of these criteria also relates to gender. Over to you, Hanan.
Yeah, sure. And of course, as we are going ahead with the response, we are also looking at the monitoring and evaluation and the indicators that we are using in our common monitoring framework. And as we have a new project also, we are really interested to learn about student engagement, as our colleagues presented in the very early, because there will be some issues we expect about the learning approaches that are being adapted by different fields within the crisis. So within this student engagement, we will be looking at disaggregated data per level, a grade, and sex and disability. And also we, in this process, we'll be able to identify gaps, and then also we'll be able to address any inequalities as we go ahead. And also part of the responding to the findings so far, we are also in a very extensive effort of doing a documentation of lessons learned through the what we have mentioned, like the community of practice of the school counselors. And we will be building on these findings in order to address different issues like access issues. And anecdotally, we are hearing that there might be also some potential issues for lower access to boys, not only girls. So this is one thing that we might be also interested in looking deeply more in. Of course, our work and the integrated work between the programs and the protection and the gender lenses is really a key, and will be also applied in order to address and present and develop where appropriate and relevant some interventions with regard to that domain. And of course, a specific example in this regard is the technical note on cyberbullying that UNRWA has developed to be shared with the fields, and it will be followed by an animation video that will talk to the students about the issues with regard to using internet most of the time for learning and for other things. And of course, we realize that advocacy is very important, and in UNRWA, we are part of the regional framework for the back to school, and we're working in order to ensure that neither boys nor girls drop out as we are moving ahead. That's it from our side. Thank you very much, and we'll be also keen to learn more from our colleagues.
Thank you so much. Thank you, Hanan and Emily. I think, yeah, powerful reminders, both sort of practical strategies that you're using, but also helping us think about the way in which we work as well. So very grateful to both of you. Thank you. So now let's turn to another panelist, and thank you to Janina from Plan, who's going to look at distance learning and teacher training in Latin America. I'm conscious we've had a few questions already around these issues, so good timing to hand over to you, Janina. Thank you so much.
Okay, thank you, Charlotte. So I want to start talking a little bit about the situation we had before. So the region, Latin American, Caribbean, used to have, we have the second highest the adolescent fertility rate in the world. And also, although we seem to almost have no gender gap in access to education, it's important to highlight that most of the causes for dropout remain different, for gender reasons. So for example, in the region, 36% of girls and adolescents who drop out of school do so because of their pregnant or maternal care. And now we have the situation with the COVID, which for the region represents that 95% of the rural learners are not accessing education. And of course, the government are responding with different strategies, but most of these strategies are related to distance learning. So like TV, radio, or online platforms, which also bring the challenging for the organizations to adapt that project to the COVID-19 response. And then I will try to share a little bit what I have been doing more in a practical way. And of course, I want to emphasize the importance of having gender lens when you design your response plan, and also the kind of tools you're gonna implement. If this is material or if this is strategy, you need to have it in consideration. So Charlotte, if you can pass the next slide, please. Thank you. So you see the very colorful PowerPoint, and so I'll give some examples. So this is some examples that we have in the region. The first one is Paraguay. So we have a superhero, Kiara. So this material is an educational material. You have that as a workbook version, and you also have that as a video. So you can share with the government for them to make use of it in radios or TV. The importance of Kiara being a hero is a girl, so you guarantee representation. And it also is a child-friendly approach to speak about COVID-19. On the side, you would have one material that's being designed and developed by the regional office in Latin America. And this material is basically education emergency material. You will have like components such as numeracy, literacy. You'll have like a tale about COVID-19 and social emotional learning as well. But today I want to highlight that this material also considers the gender lens. So you would have like chapters of the tale that talks about the importance of co-responsibility and how to divide work at home. So that brings for the children like a perspective of the importance of sharing at home and questioning why mom always do the work at home. And there's a part of the guide, the education emergency guidance, the material that is focused on adults. So we'll question the adults, like when you share, when you divide work at home, you give more to the girls just because they are girls. And you shouldn't, you should do that by age, and you should also do that like considering the protection of them. So that is one way for you to bring up those topics and also increase awareness from inside to change the big structures. Please, can you pass the next one, Charlotte? Yeah, thank you. And then we have an example on Colombia as a teacher training on gender and education. So what they're doing is as part of the Education Can Always Consortium, and the idea is to, with the context now, is to put the gender and education course in an online platform, and also have the material be able to be delivered on pen drives, because there are some places that won't have access to internet. But the main goal, it would be to increase awareness with teachers and also help teachers to have tools to how to deal with those issues. And then you might be asking, like, what's the relevance for this moment? It's very relevant because you can give like tools for teachers to interact and have a more proactive role when the students return to school. If they identify that girls are not coming back or boys are not coming back, how they can intervene and how they can support or increase awareness with the parents or with their own educational community to be more inclusive with those children, being boys and girls. Some of the themes we have gender in my students, like how to map your school with gender response, gender lens. And yeah, and then we have another last one is how do you create a cyber safe space for growth? There's a lot of material being released focused on adults, but we have to consider that the ones for children are very important as well, especially for growth. They are most endangered. So how can we talk about it and increase awareness among children on how to make good use and how to identify that they might not be in a safe environment for their learning while they are in the cyberspace. Yeah, so this is more or less I want to share. I also want to mention that it's very important for the organizations to have those lens because the government needs support with that. We have been identifying it. And also have clear that we won't have one answer for the challenge we are facing with the COVID-19, but what we should have is like a range of tools and options to use and apply in our own context. And well, I think I'm over time, so that's for my side. And yeah, I'm very excited to hear for the last presentation.
Thank you so much, Danina. And yeah, again, I see questions coming in and we'll follow up in the Q&A, but great to hear these practical examples of all the work that is happening currently. So thank you. And yes, as you say, last but by no means least, let's hear a different perspective again, this time more around advocacy for girls' education. So I'll hand over to Anna Booty from the Malala Fund. Thank you for joining us today. Over to you.
Hi everyone, thank you for the introduction. I'm going to speak about what we are doing in India to mitigate the impact of the COVID-19 pandemic on girls' education. What I'll do is I will outline what has been the situation like for girls and then go into what will be our response in the next 3 to 6 months that we will be working on mitigating the impact on girls. Next slide, please. So even before we talk about the pandemic, the situation here in India has been this, that 40% of adolescent girls have not been attending any educational institutions, and girls are twice as likely to drop out of schools without receiving they'll be receiving less than 4 years of education, less than 4 years of schooling in comparison to boys. We also know from the data that is available that 30% of girls from poor families in India have never set foot in a school. So what the pandemic really has done and will do, and as we'll see its impact in the coming months, is that it has the ability, and it has already magnified all those factors that keep girls out of school or keep them from completing their education. What we have seen as an immediate effect is that schools have closed down early, which has meant that girls are going to stay home for longer duration of time, which means that most of them will not receive their midday meal, did not receive their midday meals to begin with. They also, in some parts of India where state governments are really sensitive, girls have been receiving iron and folic acid capsules as well as sanitary napkins and some very rudimentary form of sexuality education. So those are the things that that has become inaccessible. Now, the Ministry of Human Resource Development, under which school education as a department, has announced that midday meals will be sent home. But many states like Uttar Pradesh, for instance, there are media reports around how over a period of 1 month, only 100 children have received the take-home rations for the midday meal rations that were supposed to come to their doorstep. We are also seeing that there is a loss of livelihood, the household environment changing very drastically. One of the chief reasons being the loss of livelihood, a very severe lockdown that has been in place as a part of the disaster response. This has also meant that a lot of migrant families have tried returning home, and currently they are stuck in different states. But we will see them returning home, which means returning to their native places, which means that girls will automatically be out of school. And we all know that it takes greater time for girls to be re-enrolled in schools than it does for boys. And that is another impact that we are going to see, which is quite unique when it comes to this pandemic. Staying for longer duration in homes means that girls will face violence. They are facing violence and abuse. Already there have been calls to the National Child Helpline, and we've seen that in the month of March, there were during the first 21 days of the lockdown, there were nearly 92,000 distress calls that the National Helpline received. So that's very indicative of what is what is happening to girls in the households. We also will see that girls are in their homes, and their engagement in household chores and home-based industries will keep increasing. Legally in India, children above 14 years of age can be engaged in domestic industries, and that is also the age at which education no longer is free and compulsory legally. So that is another recourse that households may take to deal with the loss of livelihoods and income, and girls may stay at home. We'll also be seeing low rates of transition from primary to secondary level. We will see a lot of dropouts at different levels. We'll see girls being married early because there will be one mouth less to feed at their own home, in their natal homes. We will also see them being engaged in labor, like I said, in home-based industries and in household chores. And we anticipate a lot of trafficking, a vulnerability to trafficking as a result of loss of livelihoods, and the importance there will be to potential incomes that girls can generate. Other panelists have spoken a lot about the impact on mental health that all of this will have. Next slide, please. So what are we doing to mitigate the impact of COVID-19 in India? Malala Fund has a flagship program called the Education Champions Network. As a part of the Education Champions Network in India, we have 11 champions who are locally and national, who are activists who work both locally as well as nationally, with very different kinds of strengths and very different kinds of perspective they bring towards girls' education. So our keys, what we are doing is that, and we as Malala Fund are the facilitators for the group. The Education Champions Network, as I said, brings together a lot of local solutions that are not available as a large-scale initiative. It is something that's tried and tested on the ground. So as the Education Champions Network, the 11 champions that we have currently have come together and developed a joint advocacy plan. The joint advocacy plan really has 3 key focus areas. We plan to, the Education Champions Network plans to map the impact of the pandemic. We plan to draw public attention towards the crisis, and then support policy makers and administrators to have more gender sensitive and gender responsive plans on the ground, so that the impact of the pandemic can be mitigated. As a part of the mapping exercise, for instance, we are generating evidence which does not exist at this point of time, which media reports and anecdotal evidence or civil society networks are talking about. Based on those consultations and based on the indications that are coming up from the ground, the assessment that we plan is going to look at what is the kind of access that girls have to digital learning, which is something that the government has been emphasizing quite a bit in India, without looking at the fact that girls are the last users of digital or online services for learning because they have very poor access to it. The assessment will also look at the incentives that the government has been providing towards girls' education, to promote girls' education, and the loss of those incentives as a part of because of the pandemic. So we are going to look at the assessment is going to look at the loss of midday meals, the loss of sexual and reproductive health services, and other entitlements like scholarships, books, uniforms, etc. to school children, and specifically girls. We're also going to map what is it in the household environment that has changed for girls and how it is going to impact education. All of this assessment will then feed into a social media campaign through which we plan to draw the attention of larger public as well as key decision makers and opinion makers about the fact that girls may drop out of school. Girls, even if they return to school, they might not be able to continue studying. What is the support that girls need when it comes to staying in the school and those reasons that the pandemic has put forward. We also plan to make a series of fact sheets. An example of our past fact sheets is on the slide. So the fact sheet will draw lessons from global and national experiences. For instance, the Ebola crisis that Nora was referring to, or the repeated floods and the kind of interventions that state governments like state of Assam have made towards maintaining a semblance of towards providing educational services in emergencies. The fact sheet will also document what has worked and what has not worked. So what we plan to do is to also look at giving concrete strategies to policymakers and administrators at various levels, and to show that these are the strategies that they can use while they're planning, while they're looking at education programming and they're looking at policy change when it comes to girls' education and emergencies. Thank you.
Thank you so much. A huge amount of work underway and a powerful reminder to us all, I think, to be advocates at this time. So thank you so much. That was the last of our series of presentations. So hopefully we've seen there a range of examples of the types of work we can be doing to apply a gender lens at this time in our work in a range of contexts and approaches. So I'm really excited now to move to the discussion part of the webinar. So Hannah, if you could just put the speaker list up just to remind everyone who we have with us today to respond to the questions. And I've seen many of you submitting questions throughout the presentation, so thank you for that. I'll now ask our panelists to put their videos back on if they're comfortable, and we'll take the slides off so you can see who we'll be talking to in the discussion. Hannah, feel free to close the PowerPoint now. Just give people a second. And perhaps while people are turning on the video, I'm also just want to remind everyone that we have the COVID-19 resource collection on the INEE website, and there is a dedicated section on gender, and we are constantly uploading with tools that are useful for the sector. So if you know of existing resources you'd like us to share, please let us know, but you can also find useful tools and resources there. And just on that point, I just want to invite my colleague Lauren Gherkin just to say a few words about some existing INEE resources. Thanks, Lauren.
Thanks, Charlotte. Just quickly to flag that in addition to our gender sub-collection, we also have the INEE guidance note on gender. This is a resource that was developed by the Gender Task Team in collaboration with UNGAI. It's not a COVID-specific resource, but it does provide a lot of guidance on delivering gender-responsive education that could be useful to COVID responses. It outlines key principles for gender responsive approaches to education programming, addresses common misconceptions and arguments against gender responsive education, and gives some concrete strategies and actions for putting gender equality into practice. It's available on the INEE website in English, French, Portuguese, and Spanish, and Arabic is forthcoming.
Wonderful, thanks so much, Lauren. Great, so let's turn to our Q&A then. The first question, everyone, that perhaps won't surprise you is the question we've had from a few different people and really relates to sort of gender considerations when we think about digital solutions. And so we've had quite a few people asking how we can address gender gaps in digital teaching and learning, particularly in these hard to reach rural areas, humanitarian contexts. So are there any specific interventions I think people are looking for to help negotiate that digital divide, and particularly think about reaching girls with remote learning? So it's quite a broad question to begin with, but I imagine it's not a surprise to the panelists to start in that way. And Rachel, I wondered if we could come to you first, sort of given the overview you have working with the Girls Education Challenge, any reflections on these concerns around the digital divide and particularly considerations around gender?
Yes, I think we've seen a number of different considerations coming through, but as I mentioned in the talk at the beginning, I think it's really important to recognise that we do need a variety of methods. Investing in just one channel, you are going to miss a number of girls, and so making sure that those channels are available and that people have choices, but to ensure that a lot of those channels do have two-way mechanisms. You know, we are talking a lot about radio setups in a lot of different environments, but making sure that they're structured in a way, and they have been used in a number of places with great success, creating more interactive spaces within the radio shows to make sure that those do have opportunities for girls to really engage with them, but also making sure that they're being broadcast at the right times of day. You know, it's important to make sure that we're recognizing that girls' household chores often get in the way of being able to sit down at a particular time of day and make sure that they are listening and engaging. So giving girls choices, making sure that we are broadcasting at different times of day to make sure that we're really thinking through those kind of considerations. But I think the inclusive nature as well is really important to think about, that when we are thinking, so for example, this channel in Ghana doing the national broadcast, that we've got subtitles and captioning in different ways for girls with various different impairments to engage. So I think it's about choices and about options and variety when we're thinking about that digital divide.
Thanks, Rachel. And I'd invite actually any of our panelists to please do come off mute if you'd like to add anything around these sort of specific examples.
Yeah, I'd just like, if I may, please.
Yeah. Please.
Yeah, just building on what Rachel said, I think it's like the trick here is not one single thing that fits all. And this is the reality that we have all to, I think of while we are doing any kind of intervention with regard to providing teaching for all services, clients that we are serving. Including, of course, girls and females. So it's the variety of the tools that we are using. And for example, an example from what we are using is that we are using in one of the fields like Lebanon, there is using internet, Facebook, WhatsApp messages, also at a certain point where applicable, at a certain time where it was applicable, also some self-learning material developed particularly for this period in hard copies that also delivered for the most vulnerable kind of children at home, also with a lot of support from the community and a lot of arrangement there. But I just stress the fact that where possible and whenever possible, because at a certain time also the movement was restricted and even this kind of modality was not really available. So it is the variety and choosing the different means and also carefully designing the things according to the knowledge that you have with regard to your refugees in our case here in Ottawa. Yeah.
Great. So understanding those needs and then bringing in that kind of blended approach with a mixture of different solutions. Thank you, Hanan. Nora, I see you want to.
Yeah, thank you. I think some of this requires us to rethink some of the hardware which we consider when we're thinking about distance learning and online learning. The World Bank is exploring opportunities to bundle cell phones along with cash transfers, so that cell phones are provided as part of the response, part of the support provided specifically to women and girls. Gives them online access to particular ways of accessing information which they would not otherwise have. Also, just SIM cards, provision of the hardware which otherwise girls and women would not be able to access these resources. In South Sudan, they were facing the reality that only 30% of the population has access to internet, to radio frequencies, to computers, and they're exploring how to provide radios, which some communities don't have. They don't have access to radio frequencies. Why would you bother having a radio? But with different ways of connecting with a USB key to the frequency, which otherwise would be impossible. So some of this requires more significant amounts of financing, but is really fundamentally breaking down the digital divide. Thanks.
Great, thanks, Nora. And Anubhuti, yes, please, over to you.
So I think there are two key considerations that one needs to keep in mind when it comes to digital access. Like for instance, in India, the policies don't talk about universal access to digital education at the primary level. So given that, for the country government to actually say that at this point of time, children should study online and try to access as much of education and facilities online is something that we need to think about. The other thing is digital learning the only way or the only solution? And I think the debates that I've been reading or hearing have mostly been about digital education and scale up. And probably we need to put our heads together and think about alternative strategies also. And some of these can be low-cost solutions costing a lot less than scaling up digital services.
Great, thanks everyone. I think this is going to be an ongoing conversation. Certainly, I know it is for our network members around this distance learning piece and how that fits in this wider work. So really grateful for all of your reflections. Another question actually that's been posed again to any of our panelists really is around whether your responses and the work you're doing is also taking into account children who are already out of school due to existing emergencies, so whether that's related to conflict, violence, attacks on schools, etc. And again, I know that has been a concern for many of our members is are we thinking about children who are already out of school? And Nora, you shared those statistics at the begin with. So again, I'd invite any of the panelists to just share some of their work and reflections to that point.
Yeah, and I think it's very important to talk about it. Like in Latin America, we've been having the Venezuela migration crisis, and all the migrants at this moment, they're doubly neglected. So the girls even more because they are migrant, the girls, and in a different country. Most of the policies implemented in the country doesn't really prioritize the migrants. So they don't. So all the resources that are being like delivered, or the public policies are not looking at them. So us as like organizations, we have to be looking and keeping our eyes on that, because most of those people won't have access to internet, won't have access to phones or TV. So how can we get to them as well? And then as Hannah was mentioning, I think like hard copies, like, the basics at this moment is very important, because it's one way to guarantee they would have one instrument to keep their education going. And I'm not only talking about numeracy and literacy, but also like social emotional support and information about WASH, or even like nutrition information. I think we have to try to, especially for those population, we need to try to find educational material that is more intersectoral, so have different contents and the same material, so they can carry that, because also they are immobilized, they're moving around, so they cannot carry the heavy stuff. So we have to think about all those things. And then this is one of the material specific for this population. It's one of our responses. Do it that we might work with the governments, then have the radios LTV. We support those interventions, but we also have to support the interventions that consider that minority in this case.
Great, thanks, Janine. Yes, please.
Hi. Yeah, so within the Girls Education Challenge portfolio, we have the Leave No Girl Behind window, which currently has 14 projects, and those are the ones that are focusing on girls who are currently out of school before even the COVID crisis started. So within a lot of those projects, we were considering informal spaces, informal education spaces already. And although that may help in some regard in terms of that thinking had already started in terms of how those spaces could work, we're also aware that we're targeting the most vulnerable girls in those kind of contexts, and maintaining support and maintaining contact with those girls in this current situation is going to be incredibly hard. So we are aware that they are the girls in those contexts that need the most support. So we're going to be working really hard to make sure we maintain that connection. But yes, it's interesting to be evolving those projects even from a space when they were beginning to think about informal approaches already. And so we're interested to see how that's going to continue to evolve through this crisis.
Great, thanks, Rachel. Thank you. No, an important question. Thank you for those reflections. And I think it also links to Nora's point about, as we're thinking about planning for the future, about whether some of these more creative and innovative solutions are going to help us reach more children and young people. So something for us all, I think, to keep in mind at this time. We do have some questions around your specific presentation, so we've got time for a few of those. And actually, Rachel, the first one is for you. I think, what you were saying about the importance of gender and inclusive analysis being sort of more important than ever really resonated with attendees. And they just wondered if you had any tips or resources sort of for logistically conducting GESI analysis during social distancing periods, particularly if sort of qualitative interviews in person are a challenge. So any tips or resources on the analysis side?
Sure. Well, I think the thing to remember is that the key principles still remain in terms of consultation and making sure that those are two-way. These are not sort of one-way channels. But the contexts are going to vary considerably in terms of what's allowed in each of the different locations. But we have heard a number of projects who are obviously using telephone mechanisms, which have proved to be quite successful, but they're very aware that that still provides a number of gaps, and that does present a certain bias already of girls who do have access to phones. And so we are hearing about various different organisations that are thinking about smaller sample sizes and potentially doing face-to-face work in safe spaces, outdoors, with all the right kind of protection considerations and respecting the local controls that are in place to make sure that everybody is safe. But in some circumstances, for girls with disabilities, or where using telephones isn't possible, they are having to think quite creatively about how to maintain that contact, to make sure that they are using those participatory principles and techniques to get girls' opinions, to get updates about what the circumstances are for them and whether these initiatives are working. And without that feedback, we're really shooting in the dark, and we're potentially investing in pieces that may not be landing, may not be resonating. So absolutely, the principles still remain, but yes, we are going to have to be quite creative and respectful of the circumstances and what circumstances we're putting staff into, and making sure that they're staying safe throughout.
Great, thanks, Rachel. And yes, if there's anything, any tools or resources that we can be sharing by INEE, please do let us know. So the next question is for our UNRWA colleagues, Hanan and Emily. And there was a lot of interest in your comments around data and how you're using data particularly related to disability. So the question is, could UNRWA highlight how they have used the data gathered on the disaggregated data and share some specific responses linked to disability?
Yeah, interesting question. With regard to disability, let me say that it has been like a journey that we are also learning in UNRWA about how to collect and how to use the data. For UNRWA, specifically the education department, we have a tool that is called EMIS, Education Management Information System. And this system is used by all schools that are managed by UNRWA in the 5 fields. And within that system, we have data that is entered by each school about the status of the students. And we link this data to various indicators that are related to our common monitoring framework about the percentage of students identified with disability, and then the percentage of students identified and supported. And of course, we had a long process by defining what we mean by disability here. And this comes from our work with the inclusive education policy and strategy that we have adopted in UNRWA. And we worked on for 4 to 5 years in order to have it launched in the fields and started rolling and have this kind of understanding. So within that system, we have the information from the schools. So we had that. And then when we started with the COVID, the teachers started working with the groups, the children, and they have the information about students with disability, that is students also who need additional support and students who might be really in need of having a certain way of learning. Maybe they have difficulty in hearing, so the teachers are actually typing sometimes some of the lesson as text and sending it to the students. So it is a tailored approach to the extent possible and based on the data that is available at the end of each student and school leader. So this type has been, possible because we have been using different mechanisms. We have been using audio messages sent to students. We have been using, as I said, different modalities for communication, WhatsApp, Facebook groups, etc. Also, there are some tips from the counselors to the teachers that they might also advocate that parents, if possible, be also the ones supporting more for the students of disability at this time of a crisis. So this is how we use the data that is available and how we reflected on that. Still, we recognize that there is a need to do more with regard how to make even those digital material more accessible to students with disabilities.
Great, thanks, Hanan. Yes, I'm conscious that came up on our webinar last week on inclusive education approaches, and like you say, I think we all need to be collaborating, working together as we learn more and try to do more. But thank you so much for those reflections. Lots, the next question comes to you. There was real interest, I think, in terms of how the measurement side of your work, and in particular a question on what are some of sort of the indicators that you're measuring, and potentially considering unintended results as well of this sort of mental health approach that you kindly described in the project. And I think particularly recognizing that the context is changing constantly at the moment with COVID-19. So any reflections from you on this measurement question?
So first I responded to that in writing, so there is a written response for everyone, but in the interest of time, let me get to this. So we are tracking longitudinally all the students in the sample that we have identified as displaying symptoms of anxiety or depression, and highlighting how this might affect learning outcomes as well as transition. So essentially looking at the extent to which anxiety and depression are showing as being a predictor of negative results for other outcomes. And as we are working with the girls' empowerment forums and school education committees, community education committees, we are also working through a participatory system to track case management. So the groups are tracking the cases that they are managing and feeding the data back to us. We are looking at the data and looking at what types of support those groups might need to address the cases, noting that this is a mitigation strategy, not a strategy that might do full counseling as others would in a different setting. And through time, we are trying to identify how this might affect the ability of the students identified as being affected to remain in school after the classes reopen, as well as to engage in classroom activities through time. So all of those indicators are being tracked on a regular basis.
Great, thanks a lot. Really appreciate you providing the written and the verbal answer as well there, thank you. So the next question relates to teachers. A few of you mentioned teachers in their role obviously in facilitating learning, but also as counsellors, and also teachers being trained and prepared to respond to GBV during quarantine. So we had a question around how are teachers' own needs being supported, particularly their own mental health and psychosocial support, but also if they are also at risk of violence at this time. So Janine, I know you've been working with teachers. I don't know, perhaps we could come to you first. Any reflections on how we're supporting teacher well-being at this time?
Yeah, I think teachers' well-being would be the first thing we should be addressing, because if they're not well, they are not going to be able to support their students as well. I mentioned in the presentation one specific training on gender and education, but we are also working under the regional group in the region to design a teacher training course for focus on maintaining social emotional ability and well-being. So the course will be more focused on practical tools, and then 2 modules of this course will be basically like teachers' well-being. So like some tools on mindfulness, on how to organize your day in your work, some like tips on how to deal with, for example, now, I don't know, I imagine the other regions as well, a lot of the projects are adapting their response to the COVID-19, and to support the government, what we're doing, it's creating like call centers, so the children have access to the programs and the TV, and the teachers can call and then have the check on that, like are they doing the homework, like how they feeling. And a lot of teachers been reporting that the children are sharing like protection issues or gender-based violence, and they don't know how to react to it. So how do I do, or what should I do in this case? So I think the focus of the training should be also giving tools, practical tools on how to react. So which lines should I call, who I should report about it. And I think that's something we need to be working at this moment. There's a lot on learning, not much I have been seeing and teaching. And also this is a great moment for teachers to learn, because they are working, trying to respond. And not only, I think learning, but also sharing experience, because they're very creative. They come up with like solutions as well. So we have to promote those spaces for them to be able to share and learn from each other.
Great, thanks, Janina. Yeah, I really appreciate that idea of the drawing on their incredible expertise and creativity of the teachers themselves. Nora, yes, please do come in.
Great, thank you. I do not think I have a solution or an answer to this, except to draw on experience which Ongai has had with Education International in working with 9 teacher unions across sub-Saharan Africa around gender-based violence and their experience themselves as adults, men and women, in being perpetrators of violence and recipients of violence. Recognizing, I really like the comment that you made about if we don't start with the teachers, they're not well equipped to respond to the needs of students. Women and men are all feeling the extreme crisis, conflict in their environments, anxiety, stress, losing their jobs, losing their homes to having to work full time, and they may well be victims of violence themselves, as well as and needing to be supported in that. I think the teacher unions should be called on, and probably are in some environments stepping up to support their members and to provide access to the kind of services we're speaking about. A call-in line for teachers provided by the union would be totally appropriate to reinforce and support other opportunities which are provided to them by Plan and other organizations. I just think it's an extremely important question, which I don't think we have a full answer to. But it's great that it's on the table, and we need to attend to that in the coming period of time. Thanks.
Thanks, Nora. And yeah, we were very grateful to collaborate with our colleagues at Education International on the teacher focus webinar. So again, just a reminder that those recordings are there. And yeah, and also appreciate it, Nora. We do need to keep tackling these issues together. So thanks everyone. I think we've got time perhaps for 1 or 2 more questions. Again, this one to open to all the panelists is really the consideration that barriers to girls' and boys' education often involves families' livelihoods, and given loss of livelihoods that may be anticipated given COVID-19 and children and young people's roles in household chores and industries, any suggestions of responses that are focusing at the level of the family would be, I know our participants would be grateful to hear. So I'll open that up to everyone again, but these sort of responses aimed at the family level would be great to share. Yes, Anubhuti, please do go.
I think there are some, this is a good time to push for making secondary education free, especially in the context of in which girls grow up. I think this also is the time to look at small, shorter term financial interventions like conditional cash transfers. Those are some strategies that one can think of in terms of in order to retain girls in school and ensure that there is a transition from primary to secondary levels.
Great, thank you. Important reminder for us again to all be advocates at this time. Any other reflections on that sort of family level intervention question? No? Yes, Rachel.
Yeah, just a couple of considerations when people are thinking about the return after this particular crisis. We've seen some interesting conversations emerging from organisations thinking about what the bursary makeup might look like after the end of this crisis. Now, at the beginning, there have been a number of different projects that have been providing economic support for girls within their context to encourage them to go to school and to cover the costs for schooling. But obviously the whole criteria are going to be very different at the end of this crisis. So making sure that projects are really thinking through that vulnerability criteria and thinking through the whole approach to bursaries or any kind of economic support and what that looks like, because obviously this crisis is really going to have an enormous impact in so many different households in terms of their economic situation. And very often that return to school piece is going to be a very difficult decision for a lot of different families. So really making sure that economic dimension is being considered as and when schools reopen, and thinking about approaches to support families to make sure that those choices are being made and girls are being supported.
Thanks so much, Rachel. And perhaps if we have time for just one more, we have had a couple of comments. I know we've been talking quite a lot about girls' education today in our examples, but a comment about, you know, the barriers facing boys, particularly with the concerns around child labour increasing and recruitment and so on. So just again, open to any panellists, just to any reflections on how we can be specifically addressing the challenges facing boys at this time. Yes, Nora, please.
One thing that's really, that everyone has mentioned and we need to reinforce is we need to monitor this. We need to track it. Clearly some boys will not go back to school. They will have been required to work for the families to keep up whatever income is possible. And we need to monitor this to find out best ways to address their needs. Maybe it will be alternative learning opportunities for them outside of school time. It may be responding to their needs differently. We just do not regularly have that kind of monitoring process at hand, and we'll need to be putting that in place in order to make sure we know what's going on and respond appropriately. So I think the question is a critical one. We need to address it, and I think we need to be informed by what's going on as we see it rolling out.
Thanks, Nora. Yes, Hanan, just 30 seconds if that's okay.
Just to stress that this is the important maybe time to monitor this kind of a challenge with regard to the boys, because as I mentioned in our example, we have been looking at this specifically for boys and what does it mean for dropout rates, for example, and for girls and boys. And we noticed the increase in the dropout rates for boys for worsening economic conditions in certain fields or certain countries. So we might be also noticing this more as we are moving out of this crisis. So it's an issue to keep an eye on. That's what I wanted to say.
Yeah, no, thank you, Hanan. Appreciate it. Janina, just very quickly, if that's okay.
Just one thing. Like before the COVID-19, we were responding to it. It's not the answer, but I think something we should ask ourselves. The reasons also, we compete with recruitment, and that normally implies like you have identity and money. So I feel like education should rethink as well, like how we pursuing education, because it's losing meaning for them. And then if it doesn't have meaning, you'll be competing with money and like prestigious, then it's very difficult. So like in Venezuela, we've been working with vocational training, and that in some cases it's been really work. So like when they have to decide, do I go for the recruitment or even the recruitment let them alone because they are working, they're studying for vocational training. So I think it's something we should also be looking at.
Great. Thank you all. Important question, important reminder for us to be monitoring, using the data to inform our work, both our response and our planning ahead, I think. I am conscious that we are at time, and I can't thank our panelists enough for their presentations and discussion today, and also for our participants for raising such important questions at this time. The webinar has been recorded. It will be shared via the INEE networks, and then please do pass it on to your colleagues. We do have another webinar this week on Wednesday, which will look at the INEE minimum standards and launch the new technical note to support practitioners in these complex COVID times. So please do join us for that. Many of the themes that come up today, I hope we'll continue to address together. For example, we are planning a webinar looking at youth and support to youth in particular. We will also be planning a webinar around planning for school returns, and we'll of course make sure that these gender dimensions and considerations are included in all of those discussions. But we'll need, we're 2 minutes over, so I'll need to close there, but just a massive thank you to everyone today.
Thank you.
Thank you, everyone.
Thanks so much.